It is ironical that India, a model economy for other developing nations, grapples with a healthcare sector, plagued with the most basic problems even today. Whether it is accessibility or quality, for a country with a burden of $1 billion, the healthcare industry finds itself under heavy pressure today. But ensuring quality healthcare for all is a crucial aspect for growth. And through innovation, we can take healthcare to all those deprived of it. And IT or information technology can be the key driver of this innovation, which will enable crucial information access that can bring an improvement to the industry.
Hello and welcome to India's Healthcare Challenge with me, Kiran Mazumdar-Shaw. My guest today is Preetha Reddy, a dynamic young woman who is playing a leadership role in the Apollo Hospitals Group. Over the next 30 minutes, I will be speaking with Preetha to see what she has to say about what we need to do to build a robust national healthcare system for our country. Preetha, thanks so much for coming on this show. Perhaps we should start by this whole area of e-health, because I know that's something you are so involved and passionate about. Why don't you walk me through what are your views and your kind of perspective on how do we create a robust IT-based and IT-enabled healthcare system?
I think as healthcare providers, our responsibility is enormous, and I'm being simplistic, but the challenge is twofold. It's geographical and it's financial. The geographical challenge is really what, e-health or the stuff you're doing, all of us are working about, it's all about that. How do we take quality health, get to every nook and corner of the country? You can't move healthcare personnel from one corner to the other. They're simply not available. So one of the answers which has evolved now and everyone is working on...
Telemedicine.
Yeah, telemedicine is one of it.
Mobile.
Yeah, mHealth. Telemedicine has moved to mHealth. Telemedicine has moved to web-based answers. So I think to me, the sky is really not the limit. It's absolutely an enabler because a lot of things can be done from a remote location. So why should somebody travel so far?
Yeah, and in fact, people are even talking about, the ASHA workers being trained to deliver primary care. And if you can use technology to train them.
It's happening. We've worked with them in Tamil Nadu, with TCS, ASHA, Apollo. We've worked together and they've got the palm tops. So a lot of the messages are going back, hub and spoke model, there's a central station, it's giving answers back. And I think this is a model when perfected that not only India will use, but the rest of the world will emulate. And then there's the whole mHealth platform. The penetration of mobile telephone users is like, millions. More than 50% of the country have some access or the other. If you can just plug it into a mobile triaging system, just a health triaging system, so many answers are left. On one side, we're still grappling with infant mortality. But if a pregnant woman can actually be told, this, go to your nearest public health center. So to me, healthcare has to be, there are 3 Ps in it. It has to be preventive, it has to be participatory, and then move to being predictive. If we can really focus on the 3 Ps, we would have done a huge thing for our country. So when I say that, it has to be preventive, all this methodology to prevent the onset of chronic disease.
Early diagnosis.
Early diagnosis, all that is in the prevention piece. Then what happens is it has to be participative, because as much as private healthcare players like all of us are doing, we're working with governments, the true PPP model in the true sense of the word hasn't happened. It's evolving. I'm not saying people are not listening. I'm not saying it's not happening, but it has to be much quicker.
And there is a need to strengthen this public-private partnership model if it has to realize its full potential in tackling the healthcare challenge. Though government measures like the National Rural Health Mission have ensured some progress in improving public healthcare, a lot more needs to be done. And capitalizing on financial resources of the private sector can be one way to do it.
You know, this PPP model that we're talking about, I think there's a clear recognition that the government, the public sector has a very important role to play. Certainly in primary healthcare, certainly in secondary healthcare, and to a certain extent in tertiary healthcare. But I think there's also a recognition that if you really want to strengthen this primary and secondary healthcare in the villages, at the district levels, in the kind of towns and sort of tier 2 cities, then they also believe that the private sector has a very important partnership role to play in managing many of these suboptimal kind of infrastructure.
And it has to be a partnership, because it's really speaking, it's everyone's responsibility. And you know, the suspicion of private sector doesn't really make sense, because the government needs a certain amount of revenue to be able to, you know, meet whatever demands and commitments they have. Private sector needs it because, you know, there's a stakeholder initiative. So I think for both of them, the end result is the same, the ask is the same. I don't see why we're working at two ends of the spectrum. But having said that, I really think that, you know, the thought process is changing. You know, the model's evolving of this public-private partnership. Recently, we opened dialysis centers for the government, you know, to take care of their CGHS beneficiaries. I think it'll all go well, but it's a question of time. It's a question of how soon can both work together.
You know, which also leads me to one more point about using IT. Okay, I mean, you know, there's another aspect of IT which is really about allowing us to map the disease burden of this country.
That's my third
plan
P.
before, plan better, you know, plan your resources, your forecasting, dealing with epidemics. All this can be done.
That's my third P. You know, that's the predictive part, you know. So really, it can take care of your prevention, it can be participatory, and it can predict. And that's why I think, you know, the quicker adoption of IT will actually make us better than the so-called developed nations. Because look at our cell phone technology. We're far better than them. So if India can do it in telecom, India can, you know, some of our roads are getting even better than theirs. Our power plants are more efficient. If we can do it in our infrastructure, why can't we do it in healthcare?
Preetha Reddy has set many a milestone in the healthcare industry and is credited with bringing in innovations like telemedicine technology to take healthcare to the interiors of India. And Preetha Reddy, a trailblazer in her own right, is aware that the buck doesn't stop there. For a country which has less than one hospital bed for every 1,000 people, and where people's trust and the numbers tilt in favor of private players, huge challenges need to be overcome. So, what needs to be done?
Now let me, you know, go to another aspect of healthcare which I know that you're also very, very committed to, which is really about what is the kind of hospital models that we should be creating. You know, for instance, you know, your father, Preetha Reddy, of course, has been a pioneer in creating this concept of multi-specialty hospitals. But at the same time, we know that we are short of 2 million hospital beds. And having said that, we also know that 60% of hospital beds are in the private sector.
Yeah.
Right?
And in the cities.
And in the cities. So how do we reach beyond? How do we, you know, address this geographical challenge, do you think?
You know, there's actually a lot to be done. The Indian healthcare landscape is huge. It needs many models to really answer the challenges. You know, you need these centers of excellence, the large teaching, research-oriented hospitals, which will really do the high-end healthcare, which